Hey friend, I have a confession to make. I used my voice way too much last week. Now, it's sounding a little bit better, but I can still hear it and feel it. Hi, I'm Kate Glasheen, and as a voice coach, you'd think I'd know how to not overuse my voice, but it can happen to the best of us. You can learn more about me at kateglasheen.com, and if you enjoyed today's video, please like and subscribe below. Let's get started. Overusing your voice can happen before you know it and for any number of reasons. It's why habits like staying hydrated and including a gentle vocal warm-up in your daily routine are so important. But even when you have all the healthy habits in place, sometimes there are just really immense demands on your voice. This past week, due to some extra demands at work, I spoke over 10 hours more than I usually do, and it wasn't just regular talking. I was coaching and teaching, so in other words, I was on. And because I'm still working remotely, this problem of extra hours was compounded by the fact that it was all online. And even though I focus on healthy habits for my voice, it is really hard not to push vocally in this noble but maybe not so efficient attempt to keep the energy up in an online session. So, how do you know when you've pushed your voice too far? What does it sound like? What does it feel like? And what do you do about it? You may feel some tightness at the level of your vocal folds, and it may be more pronounced when you swallow. Like many parts of the body, overuse of the vocal folds can result in inflammation or swelling, and that accounts for that tight feeling. And if you have any pain or it hurts when you talk or swallow, you may have also strained the tiny muscles that operate your larynx. Next, if you notice that there's suddenly more gunk on your vocal folds and you're having to clear your throat a lot, but you're not sick, that's a pretty good indication that you've likely overdone it. When your vocal folds are inflamed, the body will produce mucus to soothe and lubricate them. So if this is happening, resist the urge to clear your throat. Clearing your throat is a really forceful function of the vocal folds. Do this exercise with me. Pretend that your two hands are your vocal folds and just clap with a reasonable amount of force. Feels okay. Could probably do that for a while and be pretty comfortable. Now clap with a lot of force. I don't know about you, but my hands are tingling quite a bit. And if we continued to do that with that much force, they'd start to get red, they might get a little puffy and swell. And that is exactly what's happening with your vocal folds when you clear your throat. So the more you slam your folds together, the more inflamed they're going to get, and the more mucus your body will produce to soothe them. So it just turns into a vicious cycle. Sometimes the first indication of overuse lies in what you hear. Your voice may have a gravelly or breathy quality to it. The quality may vary at different points in your range. You may even feel like you have less control or you're having trouble speaking or singing on pitches that normally you don't have to think about. These symptoms are all good indicators, but so is reviewing your recent activities. I know I spoke and coached and taught too much last week. You know that you sang too loud at the concert or screamed while you were playing or watching a sport. And it's important to recognize these things because the first thing to do when you've strained your voice is to rest it. And sometimes that means temporarily avoiding the activities that strained it in the first place. It's rare that you'll have to go on complete vocal rest. Instead, talk less and talk at a lower volume. Whispering will just dry out your vocal folds and prolong the inflammation, so talking quietly is the goal. And then avoid caffeine, drink lots of water, herbal teas, foods with lots of water content like watermelon and grapes and things like that, and those things will help hydrate you. If you want to use lozenges or painkillers, only do that when you know you don't have to speak. Certainly not when you're performing, hanging out with friends, presenting at work, anything like that. Because painkillers and numbing agents mask the pain, you'll quickly forget that you're strained and then you'll push your voice even further. So only use those things when you know you can rest and enjoy the relief. Vocal strain is quite common and these tips should restore you back to normal within a few days. But if your symptoms persist a week or more and you don't have an active infection, or maybe even if you do, it's time to go see the otolaryngologist or ear, nose, and throat doctor. And remember, continually overusing or misusing your voice could eventually result in permanent damage. Your voice is a reflection of you, so take good care of it. I'm going to stop talking now and drink some water.